Hi, everybody. Sorry about that. When I ended the last broadcast, it made us create a new link. So hopefully most people can rejoin for this part two. So I'm going to go straight into DBT skills training. Can you see my slide that says DBT skills training? Oh, there's a little bit of a delay. Okay. So DBT skills training is divided into 4 modules in the original adult manual, and in the adolescent manual, the Alec Miller and Jill Rathis manual, there's a 5th module that was added named Walking the Middle Path. So I'm going to review overall these 5 modules of the skills, and then we're going to go through some of the actual skills that you can so that you can become familiar with them. So the mindfulness module, the overall goal of mindfulness is teaching clients how to focus their attention and expand their awareness. It's about we talk about acceptance. How can you accept what's happening with you if you don't even know what's happening to you, or what's happening inside your internal experience or the experience around you. The skills in this module are known as the what and how skills and the states of mind. We're going to go through these skills specifically, and we'll have a chance to practice as well. The distress tolerance module is the module of skills that are aimed at how to get through a situation when you cannot solve a problem. So the idea is tolerance rather than changing something or problem solving something. It's about getting through, be it a crisis or a situation that's hard, without making it worse. And this module is divided into what are called crisis survival skills and reality acceptance skills. And the names of the skills are listed here, and we are going to go through each of them individually. The emotion regulation skill is, it's actually my favorite module. I think of it as sort of emotion school. It's where we learn about how to identify our emotions, how to figure out what they're doing for us, the function of them, and or what they're signaling to us, and also how to manage them, which sometimes involves changing painful emotions. There's a focus on how to experience your emotions mindfully, increasing your experience of pleasant events, as well as decreasing your emotional vulnerability. And this phrase of building a life worth living is one that Linehan uses, in particular around suicide. The idea is that if you can fill your life and build a life that's actually worth living, thoughts and urges for suicide and ending your life are going to diminish. Interpersonal effectiveness is all about relationships, how to get your goals met, how to maintain relationships and your self-respect, how to end destructive relationships. And then walking the middle path is this additional module that was added in relation to adolescence. There's a discussion about the dialectical dilemmas. We went over those, the ones that had the arrows. There are ones that have been developed that are specific to adolescents and families. So that's the walking the middle path module. So I wanted to go in and go through each of these modules and discuss the skills, and we'll start with mindfulness. So as I said before, the goal of mindfulness is focusing attention and expanding awareness. Mindfulness is woven into all of the skills training groups that occur, which run on a 24-week curriculum. So each of these modules takes about 4 to 6 weeks to teach in a group setting. So it takes about an average of about 6 months to get through all the modules. But mindfulness, we tend to weave through in terms of practice at the beginning of all of our groups, so that it's a theme that is carried throughout all of the skills training. So the skill of mindfulness, we talk about states of mind, and we teach these 3 states of mind that exist. We call them reasonable mind, emotion mind, and in the middle, or the synthesis of the two, is wise mind. So reasonable mind, or it's been referred to in the past as rational mind, this is the side of your mind in which decisions are made based solely on rules, reason, facts, pragmatics. Sometimes we describe this as sort of the cool side of your mind. versus emotion mind, which is more mood dependent and emotion focused. It's the side of your mind that you make decisions based on emotions. You're ruled by your moods, your feelings, or your urges. Now, obviously, being in either one of these more polarized states of mind is not ideal. And we aim to bring, we aim through DBT to bring folks into wise mind. Wise mind is the synthesis between reasonable mind and emotion mind. It's a state of mind you're in when you can see both the value of reason and emotion. Sometimes we call it the middle path, or bringing your left brain and right brain together. When we teach the skill, we ask people to describe situations when they're in these different states of mind, and what are signs that they recognize that they're in one particular state of mind. Wise mind we think of as being very grounded, very centered, sort of intuition, a place of knowing. So that's we teach the states of mind. And then we also teach what we call the what and the how skills of mindfulness. I just want to pause for a moment. Are we okay technically with things? Okay. And are folks able to, have they gotten the link?
Yeah.
Do you know? Okay. So the what and how skills of mindfulness are what you do when you're practicing mindfulness, that they're referred to as the what skills, and how you do it, how you practice mindfulness. So the what skills, to observe something, and we do lots of practices that are related to this idea of observation is simply noticing. So simply noticing one's experience, or if you're doing an observed practice of something outside of yourself, simply noticing with your senses. We call it wordless watching. Here are some examples of some observed mindfulness practices that we do. Observing the breath, observing an urge to swallow, to scratch an itch, or to move, observing your body sensations, observing sounds, observing an object, or observing thoughts. So these are all wordless ways of observing. Oops. The describe skill of mindfulness, I'm back at that slide. Sorry, I was skipping around a lot. The describe skill is when you put words to your experience. So naming or labeling what you're observing. So if, let's say, you're observing sounds, you might put words to that by saying, oh, I hear a bell. I hear a whooshing sound outside. I hear ticking of the clock. So putting words to the experience is to describe. The last what skill is participating. Whoops, sorry, I keep skipping around. So to fully participate, sorry, my slides are out of order, so I'm looking for there they are. To participate means to throw yourself fully into an experience, to sort of lose yourself in that experience. Some people say you can't actually do observe and participate at the same time. When you're participating in something, you're by definition sort of one with the experience, and so you don't have that ability to kind of step back and observe. Some of these are the examples that I have listed on the slide are different sort of games or activities that we sometimes practice in group or in our consultation team that ask you to kind of throw yourself completely into an experience. You know, the snap, crackle, pop game is where you stand in a circle and you have to make a hand motion and say snap. And then the next person who receives that has to make another hand motion and say crackle. And then they pass it to the next person and they say pop. Kind of these throw yourself fully into the activity kind of practices. And this skill really is applicable in life, right? We do it in practice through these games, perhaps. And then the idea of doing fully participate in mindfulness in your life. I sometimes tell, kids who have a hard time, focusing in class, throw yourself totally into whatever that experience is. The teacher is talking or you're doing an activity in class. totally devote your mind to that completely. If you become distracted, notice it, bring your mind back to that full participation. So I thought it would be, let's see, I'm looking for the, okay. I thought it would be fun to do a little experiential mindfulness practice. I'm going to pick one of these since we're all in different areas. It's hard to do a bit of a participate as a group, but why don't we do for 1 minute, let's do the last one on this one, which is for 1 minute, observing the urge to move. So what I want everybody to do is, if you have anything in your hand, pen, pencil, whatever, put it down and sit comfortably in your chair. If you are comfortable uncrossing your legs, maybe putting your feet flat on the ground, maybe just resting your palms on your lap or whatever feels comfortable. And I will ask you to keep your eyes open during this mindfulness practice. And for the next minute, I just want you to see if you can notice the urge to move. So what does it feel like to notice the urge to move before you move? And then perhaps noticing whether you choose to follow that urge, or do you sit with it and watch that urge pass? So just for the next minute, I'd like you to do that. Okay, that's 1 minute's time. And typically, if we were doing this mindfulness practice in a group or in our consultation team, we would share observations of what we noticed. I guess they're technically descriptions of our observations. So we would put some words to the experience. Since we're not all in a group, but I will share my experience of that. I noticed, what I found interesting was to notice what it is that triggers the urge to move for me. So sometimes it was a physical sensation, like I felt like my mouth was dry, so I had an urge to reach for my water and to drink it. Another time it was actually a thought that had triggered my urge. So it was a thought of, am I managing time on this training? How much time do we have left for me to get through all the material? That was a thought in my head. And so then I moved my eyes towards the clock to check the time. I can imagine in other instances, maybe a sound might be the trigger for the urge to move. So that's what I noticed during this practice. So you're free to practice some of these experiential ones for yourself or to use them in your teams or with your clients. So that's a brief summary of mindfulness. Here's a list of some described mindfulness practices. I want to move on so that we have time to get through all the modules. I want to move on to the distress tolerance module. So distress tolerance are skills for when you can't solve the problem. Linehan will always say, if you can solve a problem, solve it. If there's a solution to, I don't know, your distress, or there's something you can say to somebody to work out a conflict, do it, solve the problem. However, as we all know, life presents many situations in which we cannot solve the problem. And in those instances, distress tolerance skills are what are called for. The distress tolerance skills are divided into two categories: the crisis survival skills and the reality acceptance skills. So the crisis survival skills, the first set are called accepts, and each in DBT skills, you'll learn very quickly, a lot of things have acronyms. Everything is an acronym that stands for something. And I'm not going to have time to go through every single acronym, but I'd highly recommend that if you're interested in learning and teaching some of the DBT skills, to get the skills training manual. The resources are at the end of this presentation, but it spells everything out. It has handouts for clients and everything. So the accept skills are about distraction. They say when you are in a crisis and you cannot solve the problem, and it's more effective to just get away from it for the moment, use the distract skill. The A stands for activities, so distract yourself with other activities. The C stands for contribute, so distract yourself by contributing or doing something nice for other people. Each of these letters stands for something. The P is push away, so that means like just put the problem aside for the moment, block it out of your head, leave it for the moment. Again, if you think about this, in all situations, sometimes this might not be effective, right? Like, so the push away skill. In one instance, very effective. If you need to go in for a job interview and you are having all kinds of anxious thoughts about, I don't know, did you leave the stove on at home or something? You might need the push away skill in that moment to leave thoughts of that for the moment in order to be able to concentrate on your interview. In other instances, as you'll see when we get into the emotion regulation module, pushing away emotions is the opposite of what we're asking people to do. We're asking them to actually sit with their emotions. So it's, when I teach this, I always highlight this, that it's a toolbox, right? You sometimes you have a nail and you need a hammer. Other times you have a piece of wood and you need a saw. You really want to make sure that you're applying the effective skill in that moment. So in a crisis, pushing away, very effective. I'm not going to go through each of the letters, but I just want you to get the gist of what the theme of some of these skills categories are. So that's distract. Another category of skills is self-soothing with the five senses, appealing to your sense of, smell or hearing with soothing music. A lot of the patients and clients that we work with, people who have had, chronic and sometimes traumatic invalidation in their life, don't know that they have the capacity to soothe themselves, right? They'll look to others, they'll look to their environment, they'll look to, somebody else take away my suffering. So this concept of self-soothing is one that we want to teach. Improve the moment are all skills that the idea is just to make the present moment more tolerable. So when you can't solve a problem, right, just make what's going on right in this moment more tolerable. I, for example, stands for imagery. Doing a visualization of going someplace safe just for the moment to get yourself out of the sort of crisis you're in currently. R, for example, stands for relaxation. Okay. Tip your body chemistry. These are skills that actually change the physiological response of your body. And sometimes people call these emotion regulation skills because they actually do change. For example, the T stands for temperature. This is using cold on your face, sometimes through the form of ice diving. We coach clients to actually put their face in a bowl of ice or putting a cold pack on their cheek. This actually results in a reduction in your heart rate, your blood pressure, your breathing will slow. So, if somebody's in a crisis, they're very angry, they're very anxious. The T and tip can actually change their body chemistry to help them tolerate that crisis. The stop skill is one that actually interrupts action in the moment and asks people to literally stop and to proceed, to think and proceed mindfully before they go forth and do something that might not be effective. The reality acceptance skills, these are all about the idea of acceptance. So we teach this idea of acceptance in DBT. That's it's very Buddhist, this idea that when you cannot change something in life, right, that life is painful. But when you attempt to fight reality, that is what causes suffering. So we can't get away from pain, right? But we can reduce our suffering. Suffering is this idea of like sort of prolonged pain that comes from fighting reality. I'll give you an example. If it's raining outside and I am fighting that reality that it's raining outside because I wanted to go to the beach today, And I sit there and I fight reality by saying, it wasn't supposed to rain. Why is it raining? That's not fair. It's raining. The weatherman didn't predict rain. I had planned to go to the beach. I have my bag all packed and everything. If this is what I'm doing, that's suffering. That's fighting reality. So the opposite of that is radical acceptance, meaning radically, completely, fully, 100% throw yourself into this idea of I think of it as wrapping your mind around reality as it is. I think of acceptance as opening yourself up to reality as it is. It does not mean approving of reality or liking reality. It doesn't mean, oh, I'm so happy it's raining out. Oh, that's okay with me. It doesn't have to be okay with you for you to accept something, for you to say, yes, I'm going to open my eyes and acknowledge reality as it is, which is that it's raining. Because only through acceptance, then, actually, here's the true dialectic. Once you've accepted something, then there's the possibility of change, right? Because once I've accepted that it's raining out, okay, now I can take my umbrella and go to the mall instead of the beach, right? But if you're just stuck on the idea that it's not supposed to be raining out, you're really, really stuck in suffering. I don't have a lot of time to go through all of these other skills, but I wanted you to get the concept of reality acceptance and of crisis survival. So these are distress tolerance skills. Emotion regulation skills are, so these are a whole set of skills that help you identify, understand, manage, and sometimes change emotion. We work on helping clients even be able to identify emotions, right? Describing, really putting a name to what an emotion is. And that's the model for describing emotions, is breaking emotions down into their components, which are, what prompts emotion, your interpretation of the emotion, how you experience it physiologically, the action urges or behaviors or expressions that are associated with the emotion, and then the after effects of the emotion. Those are the 5 components in terms of a model for describing emotions. And breaking that down, imagine someone who's been invalidated all their life or traumatized and told, that's not anger you're feeling, or you're not afraid, you're fine. Imagine how alienated they might feel from their emotions, and how crucial this kind of skills training would be for somebody like that. We talk about functions of emotions, meaning why do we have emotions, or what are they doing for us? What is the purpose of those emotions, or what are they signaling to us, right? What is fear signaling to us in a particular time? Why do we have fear? Oh, well, fear protects us from things that are important to us, being threatened, or our own safety being protected. So that kind of education and skills training on the functions of emotions. You talk about opposite action, which is a skill in which you act opposite to the urge that an emotion might be telling you to do when it is not effective, right? You can imagine fear in some situations being quite effective, like if you're being chased by a bear, you want fear and you want to act on that action urge of running away. But imagine other times when fear and anxiety have become ineffective. Somebody has been avoiding, stepping out their front door because they're afraid of social interaction. That is ineffective fear and anxiety. And we might coach opposite action in that case, which is to act opposite to what your action urge is telling you to do. We would say, oh, approach that feared situation. Problem solving, again, remember, in distress tolerance, we don't solve problems there. They're problems that can't be solved. They need to be tolerated and or accepted. In emotion regulation, we actually teach, okay, when there are problems that you can solve, how do you solve them? What are the steps to actually evaluating what the problem, assessing the problem accurately, and then figuring out what is an effective solution to that problem? Checking the facts. This is a little bit of a CBT type skill where, some people may be in their emotion mind and, assuming something's true just because they're feeling that way. Checking the facts goes through actually looking at the facts of the situation to assess whether or not they have an accurate assessment of the situation. Mindfulness of current emotion is essentially an exposure skill. It is a skill that teaches, as I referenced to earlier, a client how to sit with and notice using all those mindfulness skills we just practiced, observe, describe, and participate, how to do that with emotion. So the opposite of that push away skill I referred to, right? It's not blocking, it's actually allowing the emotion to come through you and for you to actually notice, oh, my fists just got clenched and tight. My heart started beating faster. Oh, I'm having the urge to scream and, punch the wall. Oh, this is anger. And it's exposure in the sense of um, clients are sitting with and experiencing emotion, which, as we know that phrase, name it to tame it, and I would say experience it to tame it. They learn through the experience of that emotion that emotions naturally resolve on their own. They come and go naturally without them having to act on any urges that might be ineffective. Reducing vulnerability to emotion mind is a set of skills that focus on the please part, focuses on self-care, treating physical illness, balancing your eating and sleeping, exercising, avoiding mood-altering substances. And the ABC portion of it is that accumulating positives that I'm referring to. These are skills that focus on how do you build things in your life, pleasant experiences, goals that are based on your values. How do you act in ways that actually help you build a life that is fulfilling, that is worth living? The B, for example, stands for building mastery. Mastery is getting skilled at something, a hobby or work or something that brings you a sense of competence and control. So that is the quickest summary of emotion regulation skills. Again, each one of these skills you can learn more about in the skills training manual and learn how to teach them to clients. The interpersonal effectiveness module. So this is the module that is all about skills for effective relationships. The first one being getting your goals met in relationships. Again, another acronym. This is essentially assertiveness training. How do you, walk into your boss's office and ask for a raise? How does a kid ask for a later curfew or the iPhone that they wanted, or any of those things? The D stands for describing the situation. The E stands for expressing how you feel. A stands for asserting what you would like. The R stands for reinforcing, rewarding the other person for giving you what you want. So each of these letters stands for something. Maintaining relationships. So these are the skills that are about how to balance, right? Getting what you want out of relationships, but also how do you maintain those relationships? How do I, ask my boss for a raise, but not, I don't know, insult him with what I'm asking for and, make him question our, my being his employee. So give. The G stands for being gentle in your approach to people. The I is acting interested in other people's perspective. The V is validating others. We talked about that. The E is using an easy manner. So again, all of these skills related to maintaining relationships. And then again, for maintaining self-respect, the FAST skill, being fair to yourself and others, is the F. The A is and we see this with our clients. The A is no over or under apologizing. So we all know these people who are, oh, I'm sorry for existing. I'm sorry for thinking. I'm sorry for wanting anything. How to help clients avoid over apologizing or under apologizing, meaning, offering apologies when in fact they are due, contributes to maintaining your self-respect. The S is sticking to your values. And T is being truthful. So, not lying or exaggerating or acting helpless in situations when you're not. There's a set of skills that are about how to end destructive relationships, how to assess whether a relationship is helpful or effective in your life. Does it bring anything to you and your well-being and your connection to others, or is it destructive? And then how to make that decision and how to end destructive relationships. And then skills on making new friends and getting people to like you, right? How to proximity to people with common interests, how to make conversation, how to get people to like you. So that's interpersonal effectiveness. Okay, now this fifth module that was added into the adolescent manual, the Alec Miller and Jill Rathis manual, is called Walking the Middle Path. And they added this additional module And it includes the new material is actually the third one, dialectics and adolescent dialectical dilemmas, and how to act, think, and approach life dialectically. So they actually list, I'm sorry, I don't have the handout in front of me, but they actually list a set of adolescent dialectical dilemmas that are sort of unique to a parent-adolescent or child relationship. For example, parents being caught in extremes between being too lenient versus being too authoritarian in their parenting, right? And how to balance that. Another one we call, pathologizing normal behaviors versus normalizing pathological behaviors, right? So, in the instance of, let's say, smoking weed, right? Is this a normal teenage behavior that, will all kids experiment with things like this? Or, and parents are pathologizing it by saying, oh my gosh, they have a substance abuse addiction and they've got to go away for rehab. That's one extreme. Or are they pathologizing normative behavior? Is the kid smoking weed and it's affecting their school and their ability to concentrate, and the parents are saying, oh, that's fine, that all kids do that, they all try weed here and there. So those are the two extreme examples. But in this module, it asks, it teaches about these dialectical dilemmas. And then also in this module, it incorporates these skills of validation of self and others, which we had talked about, right? So it teaches kids how to validate, how to validate themselves and how to validate others. Also teaches parents how to do that. And then it goes over principles of behaviorism, reinforcement and punishment, how to create change, in others. So for parents, sometimes very relevant when they create behavior plans, how to give rewards, how to give consequences for behaviors that they want to see or don't see. But the overall theme of this module is helping the client think and act more dialectically. So that we've reached the end of the skills training. I just wanted to share very quickly with you some of the resources that that I talked about during the training. So Behavioral Technology LLC, or Behavior Tech as it's known for short, is Linehan's organization and agency for sort of official DBT training. So if you're interested in learning more about DBT or practicing DBT, as an individual therapist or in groups, attending either a foundational training, which is a 5-day training, or an intensive training is one in which you're trained with a team. That's a great resource. They have all kinds of training on mindfulness and teaching skills. BPD Resource Center at New York Presbyterian Hospital, the NEA BPD, the National Education Alliance for Borderline Personality Disorder. They do a lot of work with families as well. They have a 12-week course called Family Connections for relatives and people who are related to people who have BPD, that provides education, coping skill strategy support. I have a family who has attended these, many families who have attended these and found them very helpful. So some books and resources for you as clinicians. The Red and Black book, Cognitive Behavioral Treatment of Borderline Personality Disorder, is sort of the Bible of DBT, and it's complemented by the Blue DBT Skills Training Manual. That's the adult version of the manual. It's a new edition of the manual that came out in 2015, and in there has some of the expanded information on those research studies that were for skills only that I had referred to previously. So if you're interested in that, you can find that in there. And then the DBT skills training handouts and worksheets is just the spiral bound. It's the easily photocopied, client-friendly packet that complements the DBT skills training manual, which is more for clinicians. The Alec Miller and Jill Rathis text, DBT with Suicidal Adolescents, that is the textbook version of the Red and Black book adapted for adolescents, and then the companion DBT skills manual for adolescents, the white manual, that's for skills training group, and that has handouts incorporated into that. So if you want to know more about those acronyms, what do they stand for, the skills training manuals are the ones to refer to. And then these are just some additional books and resources on doing DBT, as well as for families. Blaise Aguirre, who is the medical director of the 3 East Continuum at McLean Hospital. The DBT program there has BPD in adolescence, what to do when your teen has BPD. Alan Frazzetti's book, The High Conflict Couple, and then Michael Hollander, who focuses on self-harm and DBT. Kelly Kerner is more of a practical guide of doing DBT. It's a great one for learning sort of step-by-step. It goes through some of those tools like the diary card, the chain analysis. It has therapist and client dialogue snippets in there. So it's a much more practical guide. I like that text. And then this is the DBT in Schools manual that I refer to, the DBT Steps A curriculum developed by Doctors Mazza and Dexter Mazza for a schools-based curriculum for teachers and teachers in schools. So that is it. I believe that a recording of this presentation is going to be posted on Facebook and YouTube. So if you want to go back and listen, and if you have, I guess contact information will be probably posted, or you can reach me through Boston Child Study Center, Los Angeles, for any comments or feedback. Appreciate everybody being here today. Take care.